how do we incorporate content in these big classrooms? I know Kenya as a country, our classes are quite big, especially if you teach in a public school, or if your child attends a public school. If you're in a community where you work with kids from, you know the nature of our classes. So choose any of these questions and answer them in the chat box. If you want to speak instead of chatting, you can raise your hand and give your answer. Any of the questions.
I'd like to answer question 2.
Go ahead.
The challenges that I face in teaching large classes is differentiation. I'm not able to reach to all learners, stretching the high ability learners, and again, working with the low achievers. It's a big challenge.
All right. Any other input? Any other questions someone wants to answer? Khadija has her hand raised. You can unmute.
I have a colleague here by the name Prosper who wants to answer question 1.
All right.
I'm teaching a class of...
Raise your voice a bit.
I'm teaching a class of 80 students.
80 students.
Yeah.
Congratulations. 80 is not a small job. Kate?
Hi everyone. I'm going to answer question 4. No, question 3. The effectiveness in learning in large classroom, it's very minimal. Only like less than 10% of the students get to understand whatever the teacher is saying. Because in most cases, you find that the teachers are concerned on the student who perform well. So the rest are just there. So we can say the effectiveness is very low.
Yeah, true. Any other person who wants to answer any of the questions? Maybe the last one, and then we can move. Having too many students, there are some answers in the chats. Mina says having too many students is of course a problem, but it also affects how I teach. I love to incorporate movement in the class, but with so many students, there just isn't enough room. Okay. And then I see there's also Mukiza. I don't know if someone can read for us what Mukiza put in the chats.
She says, I'm teaching a class of 120 students, but the challenge I get is that I can't reach out to each and every learner one by one. Yeah, 120.
That's quite a big number. So actually this forms the rationale of today's topic, in that most of our classes are big. There's that child that will miss out. There's also the preference that a teacher would give to the bright students because it's easier to deal with them. So this is something that we need to address in normal circumstances. But when we're incorporating content, it could even be something that is off-putting, because someone, as a teacher, you would just want to finish your lesson and leave. So that is the rationale of today's session. Aldrin says, hi, the class I know has 30 students and the performance is okay since the teacher is able to reach out to every child. Thank you. So we can go to the next slide. So this is, it's a bit hazy, but it is just an example of some of our classes. And you can imagine, as Mina said, how incorporating movement is hard, because if you look at this class, you cannot even see where it is that you can move through. Okay, so most of our classes are almost like this. So this is something that we need to think about. So we can go to the next class, the next session. So our objective, this is a series. It is a series of sessions. And as the chair mentioned, the continuation will continue probably in the LPAC development sessions that happens every 2 months. And maybe if at some point Mina has a space after others also present, probably we will come back. So the objectives are to describe at least one strategy that one can use in teaching content in large classroom settings. So by the end of today, even if anything else doesn't come in, but at least come out of here with a strategy that you can use in that class. And then create a clear lesson plan. These ones will come later. Today we are going to deal with the strategies, but all the same, I'll mention them at the end of the series. Again, we will create a clear lesson plan of how you can teach content in class. Identify the reading and writing, and again, listening tasks that you can use in a classroom setting, because at the end of the day, even when you're incorporating content, you need to bring in the language objectives in there. Then again, determine the appropriate assessment tools so that you can know how well the content is being grasped by your learners. So we can move to the next slide. So today, what we are going to do as we look at strategies, there are different strategies. So I don't know if anyone wants to share if they've come across any of these strategies that I've put here. There's jigsaw reading, there's think, pair, share, there's group discussions, jigsaw vocabulary, and graphic organizers. So most of these activities that we use are learner-centered. So I don't know if anyone wants to share if they've ever come across such activities. You can place in the chat or you can say something about it. Yes, Tony raised his hand. Yes,
Hi.
Tony. Hi.
So the one I've come across, mostly the one I've familiarized myself with is group discussions. In high school, we used to have group discussions for various subjects. You find that the class is divided into maybe groups of 5, 4, or even a smaller number. Then you discuss, you come up with your own conclusions. Then later you can present them as a group in the whole classroom. Then after all the groups, I think, present, I think we get to understand better.
Oh, thank
Yeah.
you. Thank you so much, Tony. And I'm glad you're giving that from even a perspective of how you used to do it as a student. So thank you so much. I see Hadija's hand is up. Hadija, go ahead. In the chat, I see Francisca. I have done group discussion in my classes. And yes, Hadija.
There's a friend who wants to share his contribution by the name Diakoa.
Please go ahead.
Yes, good evening.
Good evening.
Yeah, yes, the strategy that I would prefer to use is think, pair, and share, whereby you provide a task to learners. First, they have to conceptualize about them, then they, in pair, they conceptualize also. After then, they continue sharing, where after a few minutes, you find that the whole class is aware with the concept that we need to teach. Thank you.
Thank you so much. What he has said, if you've heard him clearly, you let a learner think about the topic or the question, and then they pair and share what their thoughts were, and then they can again share with a larger group, but at least it gives someone that moment to think to themselves and have some critical thinking or something. So it really helps. I see people have used, especially the group discussions, and it has worked well. Maureen says, oh, this is from the earlier discussion. Patricia has used group discussion. Aldrin has come across group discussion. Francisca also, and Mina has done all apart from Jigsaw. And then Maureen Juma says group discussion. So there's also something called, there's graphic organizers. If you can see here, we have a flow chart. So for example, if it's a content topic, maybe at this, you can decide you're looking at the process, for example, of if it's mental health, maybe, and depression, process of the different symptoms that someone shows when they are in a depression. Okay, so you can start from the list, from the one that is not very serious, the least serious. So you start here from where we have the first chart, then you move to the next one, the next one, the next one, the next one. So if you use that, it makes the learner know how this depression starts, and if it is not taken care of, it can easily lead to the other, to the other, to the other. So it makes them understand better. For example, if it's something, because content, it can be mental health, it can be climate action, it can be anything. It's just that for us, we've chosen to use depression as a topic. So for example, if we are talking about, destruction of environment, how does it start? Maybe it starts by ignoring the things that spoil the environment, then you move to the next. After that, people maybe start cutting trees. After that, people may, and until it comes to a point where like now we have no rain at all and food insecurity and all that. So that's how it goes. So today we are going to practice jigsaw reading in our breakout rooms. I'm very excited about that. So I want us first to practice it, then I'll come back and explain it after you have done it, so because it will be easier. You see, just like the jigsaw here, you have different parts that are supposed to be put together to come up with the whole, something that makes sense, if it's a picture and all that. So that is what it's all about. So I think we can move to the next slide so that we start practicing this jigsaw reading, then I'll come back and explain. So the rationale of this content topic today is that many mental illnesses similarities to typical adolescents' behavior. You see, if you are a teacher in a class, and especially at the point whereby you have learners who are already in the adolescence age, teenagers, so they might behave in a way you feel, and we usually say that adole namsumbua. I know Mina also understands Swahili now. So like adolescence is disturbing them. So at times it could be that it's not even the adolescence per se, but maybe they're going through something. So we might end up ignoring, but it actually affects a kid and their learning and all that. So this is giving you a chance as a teacher to help that learner in your class, because always we've depended on teachers to shape and mold these young people. So again, it leads to poor performance, of course. It could lead to criminal activities, even in schools. I know you've come across the drug peddling. In 2018, 2019, we had cases of arson in schools. We've had cases of bullying. And then the other thing is that why we also want to talk about mental health issues, the depression, is the stigma. You see, when we talk about it in class, we teach it as content, we are breaking the stigma. So a learner will see it as any other illness, like the way you can have a headache, and they can easily seek for help. It will eventually improve their performance, and it will create a good environment in the school and society. Many don't know of any treatment alternative. So probably when you're having that discussion, you come to a point whereby you look for, this is how it can be treated. Learners may not have the vocabulary to tell us that something is wrong, okay? So when you're doing content in class, you're actually relevant to what is happening in society, and you're teaching them how to express themselves in a way that they can actually talk about that particular topic in a functional manner, okay? So we can go to the next slide. Are there questions before I move? Maybe you can drop them in the chat. We'll have a question and answer session later. So these are just the statistics, and they're not small. Like we are seeing 20% of adolescents may experience a mental health problem in any given year. 50% of mental health problems are established by the age of 14 and 24. These are kids who are still in school, university and all that. And that's why it's important for us to think of incorporating mental health content in our language classrooms. Again, adolescents aged 12 and 17 years, according to the CDC, Center for Disease. We heard of CDC a lot during COVID. Had persistent feelings of sadness and hopelessness. So we can go to the next slide. So now we come to that moment that we've been waiting for, the breakout room sessions. So how we are going to go about this, there's a group 1 that will do the goal. The first thing they'll do is find out anything about depression in this article. I'll share these links. Probably, Mina, you can share from your end in the chat, and I'll also share in the WhatsApp. So group 1 will look at anything about depression in this article. And then group 2 to 5 will go to this article, and each group shall identify everything about what depression is, what causes the depression, the symptoms, and the treatment. So how you go about it, in the first group you are going to, you remember the group that you go in the first session. So there will take like 2 minutes, and then we will now assign every member of that group a subtopic. Maybe 1 or 2 people, depending on how many you will be in that group. You will assign each other, like these 2 people will look at what depression is. Another 2 people or 3 will look at the causes. Another will look at symptoms, and others will look at treatment. So that is the only thing you will do in the first breakout session. So remember your groups, and also remember the topic you've been assigned, because eventually we will go back to that group. I think we can do that. Then when we come back, we will go to another breakout room, but first let's assign each group member the subtopics. I don't know if there are any questions before we go, any clarification. You can write in the chat or you can ask.
So let me make sure that I understand. So everyone will go to the breakout room that they're in. I've created 5 big breakout rooms. If you're in group 1, there is a link there. I'll also put it in the WhatsApp. And then if you're groups 2 through 5, there's a different website to go to. Is that correct?
Yes.
Okay. And how long will we be in them?
For this particular session, since they are just for the group 1, they can continue being there. We'll go down, maybe before we go to the groups, we'll go down and create our own rubrics of the period that they will spend there. Eventually, the first session, we'll just use 2 minutes for members to assign each other a subtopic in the larger topic of depression.
So they only need to choose a topic for now.
They just choose topics, like each group has to explain everything about depression, but they're assigning different subtopics to different members of their group. For example, if group 1 Someone will talk about what depression is, another one will talk about causes, another one will talk about symptoms, another one will talk about treatment. Same applies to group 3, group 4, and group 5. So after you choose the issues that you will deal with, you will not go and look at the article, you will come back, then we will send you to other groups which we will call expert groups. So if in your group 2 people chose what depression is, they will join other members of other groups that are talking about what depression is. So they will discuss that, then we will come back to the groups. If it's 2, 3, 4, 5, then you will share what you have learned from the other teams. Then now each team will come back and give their summary of what depression is, causes, symptoms, and treatments.
Okay.
So probably
Topic. Rukia, am I correct about that?
yes, you are. So
Okay.
I was in group 2, but it appeared as group 1. So I might
Ah,
have given them wrong instructions. If Delphine and Selena are here, I don't know if Selena and Delphine are here. Maybe they can. Delphine initially wanted to do causes of depression, and Selena, I don't know. So maybe they can choose an expert group that they want to join, and then they can go back to their group after this. So now, going forward from here is when we go to the expert groups. So we are going to create other expert group breakout rooms, either what depression is, what are the causes, what are the symptoms, or what is the treatment. So you'll go there, discuss, then come back and go back and share with your team. So remember the group that you are in before you go into the expert group discussion room. So here we can go to the rubrics and agree how many minutes do you want us to assign your discussion in the expert group. Anyone can give feedback, is it 7 minutes or 10 minutes? You can share in the chat or raise your hand and unmute. Khadija's hand is up. You can unmute.
Okay, I think 10 minutes would be enough.
Okay, I see also 10 minutes in the chat, so I believe that is okay. Then what should we assess during group presentation? When you come back to present, what should we be looking at? You can share in the chat also or raise your hand.
Expertise in the area.
Expertise, What else? We have expertise in the area, probably creativity in how you present,
maybe clarity.
clarity. I think we can go by that. And then how many points do we assign if you present in a way that first, if you finish your discussion and you effectively finish and answer the question within the allocated time, do we allocate 5 points or 4 points? 5, okay. 5, I also see 5 in the charts. And then again, I think the same points will apply to the creativity and the other expertise and all that. Okay, so now we go to the expert groups. We've agreed that it is 10 minutes. And even when we go back to our groups, it will still be 10 minutes, and we'll take a note of the points that will be assessed when you're presenting. So you will have that in mind. So now we can go back to the breakout rooms. We have shared in the group the links. So if you cannot find it here, you can find it in the groups, the virtual English language groups, and I'll share the same in the English Mastery Community group. So the groups will be created according to the subtopics you chose. So if in your team, you're the one representing the team for causes of depression, you go to that group. If it is what depression is, again, you go to that group, and that way until everyone gets into their room.
Yes, the groups are labeled, so you should be able to choose the one that best suits you.
That is apart from group one. Group one will just continue checking anything about depression in that link assigned to group one.
I didn't make a room for group one. Maybe group one can just stay here in the main room.
All right.
Okay. I believe we have everyone returned.
So I think it was a very engaging discussion. I went into some of the rooms, and I actually saw that people managed to pick the different aspects of depression from the groups that they were in. Congratulations, team. So we all have the rubrics, and as people present, you can try and score. Actually, that's what you also do in large classrooms. You help, you know, when we were in school, we were exchanging books and marking for each other. Now you can, once they know the rubrics, you can also try and gauge from what we discussed before. Have people been able to discuss everything about what we allocated within that time period, and now the other aspects of presentation and all that and all that. So probably we can straight away go to groups presentation. Each group will have like, is 1 minute enough to present in the respect of time? What do you think?
Yes.
Okay. Does everyone agree with 1 minute presentation? What do you think, Mina? 2 minutes? Okay. 2 minutes. All right. So which group goes first? Do we go by number 1, 2, 3, or people volunteer? Assessing expertise, creativity. Yeah, that's a good reminder. So how do we go about it? Do we just call group 1, or do you want to volunteer to be the first one to present? So you can say the name of your group and then present what you have to. Volunteering, Maslin. Okay, you can go ahead and start. Mention your group and oh, you're saying volunteering is much better. Okay, please go ahead and volunteer. Someone please go ahead and volunteer for your group. Have Tony, you can go ahead.
Hello.
Hi.
So I was in group 5. Hi. I was in group 5. We divided the task into 2. Yeah, I'll do the first 3 parts, then Dr. will finish with the last part. So the first thing was depression. What is depression? Depression is a common and serious medical illness that negatively affects how you feel, think, and ACT. I will also do the courses. Before the courses, I also do the symptoms. So I will start with the courses. One, we have biochemistry. This entails the difference in certain chemicals in the brain, which may contribute to symptoms or depression. Yeah, we also have genetics. Depression can run in families. For example, if one identical twin has depression, the other has 70% chance of having it. This generally deals with inheritance and variation. We also have personality. People with low self-esteem who are easily overwhelmed by stress or who are negatively pessimistic appear to be more likely to experience depression. Basically, if your self-worthiness is low. We also had environmental factors. Continuous exposure to violence, neglect, abuse, or poverty may take some people to more vulnerable depression. To add on that, we also have life events. Some of this may occur, maybe a loved one dies or passes. You may find yourself in depression. We also have physical health problems. And lastly, I'll do the last part, which is about the symptoms. One of the symptoms, we have feeling sad or having a depressed mood. We also have loss of interest or pleasure in activities once enjoyed. You find that someone is bored, you just there, you don't want to engage in these activities. We also have changes in appetite, maybe loss of appetite, which is accompanied by weight loss or gain in unrelated to dieting. We also have trouble sleeping or sleeping too much. You may find yourself that some people lack sleep, they don't get sleep, while some people it's the reverse, they're sleeping too much. We also have loss of energy or increased fatigue. Then increase in purposeless physical activities, e.g. inability to sit still, pacing, handwriting, or slowed movements, speech, and the related. We also have feeling worthless or guilty. You'll find that you're just blaming yourself because it's about depression. We also have difficulty in thinking, concentration, or making decisions, because probably when you are in a depressed mood, you're not in the right senses. It's hard to make decisions, yeah, because many decisions you make maybe they're not that right because you're not judging it from the mental perspective. Lastly, we have thoughts of death or suicide. Maybe people with depressed moods just think about to get rid of it by maybe suicide or death or other things such as taking an overdose. Yeah, thank you. So Dr. will finish the last part, which was treatment. Thank you once again.
Okay, thanks, Tony, and thanks to all. Under treatment, it was good to discover that most treatment, 80 to 90% of depression is treatable. And there are 6 ways of treating. One is thorough evaluation by the psychologist doing an interview, or the physician doing a physical examination, or a blood test to rule out any cause that could be because of the thyroid gland not working or vitamin deficiency. Secondly, medication can be used. Antidepressants, which do not change the moods and brain chemistry, that changes the brain chemistry so that it works well, but does not interfere with the moods of the person, the medication. Thirdly, psychotherapy, which is basically talking to the person and using the CBT, where you want to change behavior by talking to that person and letting them live in the present, not what happened before, so that they can move on slowly with their lives. Fourthly, electroconvulsive therapy. And this is the last resort if all other treatments have been tried, where the brain is given a brief electrical stimulation. And it can be done 2 to 3 times a week for 12 weeks. And it needs trained professionals, especially the doctor, the anesthetist, nurses, and that group of people. And fifthly, there's the self-help, which we can all employ, which is regular exercises, quality sleep, eating healthy, and reduced alcohol intake. And depression is a real illness, but with proper diagnosis, it can be overcome. Thank you.
Thank you, Judy, Tony, for your team. Big up. I think now we know something about depression. Let's go to the next group. Hadija said that Patricia is representing on their behalf.
Hello, everyone. Well, I didn't actually know I was presenting, but most of the things we discussed, group 4, have been mentioned. For example, the group I was in was talking about the treatment to depression and what the Cherry has gone through, because I was in the same group with her, is exactly what we discussed, so I don't need to repeat that. The other one was what depression is, what has already been discussed. So I think, and the causes, we were also discussing that, and has also been discussed. So I don't think there's much, there isn't any point that was left that I should talk about. Thank you.
Thank you, Patricia. I don't know how many marks you're going to give group 4, because they said same as above, hali kadhalika. Okay, let's go to the next group.
So are we supposed to repeat what has been said? Because we are reading from the same manual.
There is something that you will explain in words that are like different. I'm sure you'll use different words, and then the issue is the exchange and the repeated nature of these responses that helps also the learners grasp better.
All right, so I'd like to talk about, I'm presenting group 2. We discussed about the causes of depression and the symptoms. To start with the causes, we talked about environmental factors, whereby if one is continuously exposed to violence, or they're neglected, or they're abused, or they've been brought up, they're very poor, they're very vulnerable to depression. We also talked about personality, where people with low self-esteem, who are not confident, they generally get very overwhelmed, and they're pessimistic, they're discontented, they're likely to suffer depression. We talked about genetics, whereby depression runs in families. And in that, we found that maybe identical twins, if one suffers depression, there is a likelihood of the other twin suffering from depression at some point in life, or their children. We also talked about biochemistry, the composition of the brain. There are certain chemicals in the brain that might contribute to symptoms, and this is beyond us. So those are the 4 points that we discussed: biochemistry, genetics, personality, and environmental factors. And for the environmental factors, I can say there are those that we can control, and there are those that we can really not control. We talked about the characteristics. How does depression present? Most of the time, people suffering depression are anxious. They're generally discontent. They have self-doubt. Most of the time, I don't look good. I don't think I'm good enough. I can't do that. They're hopeless. They say there is nothing good in life. And there is either loss of appetite or too much appetite. And when there is loss of appetite, definitely one will be fatigued. There'll be weight loss, or suffering from these lifestyle diseases, heart attack, obesity, and you can name them. They're also isolated most of the time. They are loners. They don't want to associate with people. They do not like teamwork, these team activities. They don't like them. They're also mood swings. They're always agitated. You come to the house, you don't want to talk to anyone. You're so moody, you're inapproachable, and there is sadness. There could be excessive sleepiness, or maybe someone wakes up very, very early. There is also lack of concentration that affects the cognitive part. Loss of concentration, very slow in processing, and that also affects the rate at which they do or they perform the activities, and they're also suicidal thoughts. That's all that we discussed in group 2. Thank you.
Thank you so much, Delphine. Very elaborate. And I think I've learned other issues. As much as you're saying it's similar, but I've learned also a few more issues, especially on the environmental part while you are presenting. Now, there's the last group is Robert, group 1. He's presenting on their behalf. So try to stick to the 2 minutes so that we can move to our final part.
Hello. Now, thank you for the opportunity. Group 1, we discussed several things, but then from the presentations that we've already had, it wouldn't be very prudent to go over everything again, but we'll give our perspective on what we discussed rather. First of all, our main focus rather was on the causes of depression. We got to discuss this in depth and unfortunately ran out of time. So some causes of depression vary from abuse. This can be physical, sexual, or emotional abuse. This makes one very much vulnerable later in life, and this leaves them at a position where they could easily fall into depression later in life. Age is a factor. Age is a factor. For me, I feel like the elderly are at a higher risk of getting depressed. This can be made worse by the fact that such families, of course, most family setups, when people grow old and get opportunities, different parts of the world, and they, of course, move out of their parents' houses, and the parents remain alone. At some point, they are bound to fall into depression. Certain medications taken for pain, etc., such as the corticosteroids, also leave one at a position vulnerable to fall into depression. We discussed this. Another point is conflict. Conflict within one's environment, such as work environment, home environment, community and society expectations, etc., leave also one vulnerable to fall into depression. Conflicts are not the best ways to cope emotionally and mentally. So any sort of conflict that puts one into such a corner, then depression is bound. Death or loss, sadness, grief, all in one, often also leave one vulnerable to fall into depression. Loss of a loved one, that's why it's recommended as part of grief recovery program, somebody should see a therapist or so, because at some point you'll feel you are strong and all that, but then it always leaves a mark. We also had previous presenters giving us the factor of genes. A family with a history of depression also increases one's risk of getting depression. Many people have tried, and scientists have also tried to find out what is this gene that causes depression, and maybe get to look at the genetics of depression and things like that. Studies are still ongoing, but the findings are giving that at least 70% is genetically connected to individual. If your family has a history of people getting into depression, it is a vulnerable point. Also, major events in someone's life, change of work environment, graduating, getting married, new things especially. You don't know how to navigate this and don't know what to expect. This could also leave you with clinical depression at some point. Serious illnesses such as chronic ones, we all know them. They put us down. Even at some point when somebody gets a physical impairment, you get into an accident and you no longer can perform tasks that you used to easily do without anybody's help. And now you need to be pushed around, things like that. It basically also leaves you vulnerable and somebody could fall into depression. That is the much we discussed. I don't want to go into other details that we did not. Thank you so much.
Thank you so much, Robert. That was also very elaborate. I see Masline's hand is up.
Hi guys, I want to people saying about love. Love can bring you into deep depression when you're left by, especially your partner. You battle with the depression because you can't accept the way they left you, or why did they leave you, or what happened. Then there's also pregnancy. During pregnancy, women tend to get into depression especially those that are not supported by anyone. So they'll be thinking like, probably I don't know where I'll get money for this kid, I'll get clothes. So they end up being depressed such that the baby will not grow to a healthy baby. So in the end, it brings complications to the health of the mother or the baby. Thank you.
Thank you, Marceline. Thank you very much, everyone. I've learned a lot. I've learned new things from different perspectives about depression. So we can go to the next slide. I wanted to explain the jigsaw reading after we are through, so that I'm explaining something that you've tried. So the jigsaw reading is basically, you take a topic, a content topic, divide it into different parts, and then have each group send a representative to an expert group the way you did. Then they come back and share with your team. Then you consolidate each group consolidates its content. I think it is now clear because it is something that you practice. I know because of technology and this movement to and from breakout rooms, we've spent maybe more time than a normal lesson would be in a class. But in class, since you're in the same class, it's easy to move from one desk to another, one group to another. I specifically put group 1, which we never got to explore that. There's a group that I gave a link. The other link was sort of organized. You could see what depression is, causes, symptoms, treatment. The other one was mixed with so many things. So as you share with your learners, one thing you need to take note is their age. So you scaffold them by giving them content that is easily palatable by them. So you can maybe get some content from either the textbooks that you're using. You can prepare handouts in advance. Then you share each group, you give them that handout, then they can divide which group does what, which member of the group does what as they go to the expert groups. Let's go to the next slide. So probably as an exit ticket, you can write in the chat, or you can raise your hand and say one thing that you've learned if you want, one question that you want to ask, and one suggestion that you would want to make as we move towards finishing the session. So our topic, if I'm to summarize, we were talking about teaching content in a large classroom setting. There are different things we want to achieve through this series. We use depression as a topic, but you can use any kind of content and bring it in this context. So is the strategies that you can use in teaching content in large classroom settings. Then eventually, as we move forward, you're going to look at assessment, you're going to look at I learned that it's very possible to do a jigsaw reading online. Okay. Thank you. So we are going to look at other aspects, but today we focused on we focused on the strategies. I see Hadija's hand is up. I'll come to you. So in the strategies, we talked about jigsaw reading, which we have practiced. We talked about group discussions, which you are very familiar with. We talked about the flow charts and all that. And we also talked about jigsaw vocabulary, which I did not mention. But jigsaw vocabulary, you give different vocabularies or related to the context to each group. Then they go research on that vocabulary, what it means, give an example of maybe a sentence in that context and all that, then they present. Then that will eventually bring out the vocabulary and the contextual use of that vocabulary in relation to that content topic. So maybe that's your homework, to go and look at the other strategies that we did not go into details about, but at least, as we said, we come out of here with one strategy in a clear way. So Hadija has her hand up, so you can go ahead and unmute.
Okay, thank you, Rukia. My friend wants to say something on the exit ticket.
Okay.
Okay. I would like to talk about the first question. One thing that I've learned, according to the topic, I've learned that depression is something which can be cured, and everyone sometimes can be found in depression in one way or another. The matter is to share and to find out the treatment as it has been explained in the discussion. Thank you.
Thank you so much. I have some comments here in the chat. I learned a lot about treatment of depression. Delphine has been using Jigsaw, but she didn't know what it's called. Today now she has learned. I love that the Jigsaw reading becomes, because the class becomes student-centered, right? And I believe many people will remember this topic and will grasp the content that we want to teach because of that exchange and the learner-centered nature. About causes and treatment, someone says they learned. Then we have what a great takeaway. Oh, Mina. Then someone is asking what's the difference between stress and depression. Stress is the normal, like when you feel that your limits are beyond what it is that you want to, you're expected to do. At times when stress is too much, it can make you unable to do your day-to-day activities. Depression, on the other hand, someone can feel stressed, and if they don't take care of it, maybe because of reasons like the way we were being told, environmental reasons and all other reasons, if you don't try to manage it, it could lead you to depression, slowly by slowly, and eventually to clinical depression, when you feel now you cannot eat well, you're not sleeping well, your concentration is poor, because you have not been able to manage the issues that cause the stress in the first place. At times there is good stress and bad stress. There is eustress, which is, and there's also the bad stress, like the stress we feel during exams, it makes us read and all that. But there's also that stress now that makes you isolate yourself and start feeling like you don't want to do your daily activities the way you usually did it. You're not eating the way you are doing. So that could now tell you that now this stress is becoming more serious and it is getting to a depression level. There are a lot of comments here. How to differentiate a very quiet and depressed student? That's a very good question. Look at the signs and symptoms, the way we discussed here. Look at those symptoms, then judge from how that student was before. If it's a new class, if you're a teacher, if it's a new class, maybe as the term progresses, you'll get to know what that student is like. Maybe that student is just introverted and it's okay. Any kind of personality is okay. There's no good or bad personality. But if a student is very active and then they change to go very quiet, then that is a sign that you need to take note of. And all the other sudden changes are good to take note of. Can depression make someone mad? Untreated depression can go to limits, because we see them, even someone going to the level of dying by suicide. But if it is managed, then someone can be able to get out of it. And maybe I wouldn't use the word mad. That is what we use in the society. We say mad, but it's because of probably the levels. At times someone is high, at times someone is low, or maybe they have schizophrenia. And maybe during that time, they also suffer depression, okay? So it will not make someone mad, but it will make someone behave in a way that at times they feel they are going through some hallucinations. At times their moods are so hyper, at times they are so low. Those kind of oscillations between one mood and another. So if untreated, it becomes very extreme, okay? And it destabilizes someone's normal functioning. But if it is managed, someone can live a normal life, even with any kind of mental health issue. I think there are so many comments in the chat and also questions to do with depression. Probably we can have a discussion in the chats about this in the EMCG and in the VL. We can extend the discussions on specifically the topic. You can go back and read the content in the links, and any other questions coming in, we can try and also tackle them from the chats. I don't know. I have noted that many students have become suicidal. Could it be that there is a rise in depression? Actually, when someone is feeling depressed, it's so easy to go into suicide when they are not helped out of it, because at the time when someone is depressed, they are feeling so down, they feel like life has no meaning and all that. So they usually that cry for help. At times we see even on social media, someone saying, I would rather die and all that. Let's not ignore, let's give positive comments so to get someone out of that mood. At times you never know, your words can help someone if you say positive words to that person. So depression is easily something that can lead to, and especially loss of life, and especially someone who is going through bipolar and they're depressed at a moment, when they get the energy, they can easily take their lives by suicide. So it's always good when you see a cry for help, you go ahead and say positive things. And if you can reach to that person, you reach out and help them get out of it as per the level of your ability. So I think, Mina, maybe I can say I've come to the end of this for today. I wish to thank you for your participation, and I take the session back to Mina.
I think we can all agree that we really learned a lot today. And it was interesting too in the comments, a lot that we learned about depression, but also this great strategy, as Patricia said, it's a great strategy for dealing with a large amount of content and making it manageable. And then, as many of you noted, very student-centered as well. We were all very active during the session, and actively learning. And so I want to thank you very much for providing this very interesting and beneficial presentation. We'll be back again on March 14th, and we'll be looking at peer assessment and feedback, which we did a little bit of in this session. And then on the 28th, Robert, who's here, will be, he and Josiah will be taking us back to special needs. So we have lots of great sessions coming up. Thanks, everyone.
Thank you. Thank you.
And thanks, Rukia.
Welcome.
Bye.
The pleasure. Bye,
Bye, bye.
everyone.
Bye.
Bye, all. Have a wonderful evening.
Bye.
Bye.